Once we finish with deformity, we're going to move on to disability, which is page 6 in my book, flow diagram number 6. We want to check to see if the patient has any type of disability caused by a spine injury. And so what we want to do is we want to take our fingers, place it into our patient's hands, and ask our patients to squeeze our fingers. Then we want to check for sensation, and we're going to tap on one of the patient's fingers on each of their hands. We're going to go to the patient's feet. We're going to put our hands up against the patient's feet, and we're going to ask the patient to push on our hands. And the same thing, we're going to tap on the patient's foot, asking the patient, what toe am I tapping on? So we can check for sensation. Now we're going to log roll the patient onto their side. There's a log roll checklist on page 6 of my book that you'll be able to see. You'll also see a demonstration of a log roll right after this presentation, so you'll be able to see that. We're going to log roll the patient on their side in a spine-safe way, supporting their head, and then we are going to palpate their spine with the hand that we have on their hip. We're going to start at the base of the skull, and we're going to push all the way down to the pelvis. What we're going to be listening for is bone grinding on bone. We're going to be feeling for soft spots, and there should not be any soft spots along the spine there. And we're also going to be listening to the patient to see if they report any type of pain or anything as we push. Once again, if the patient cries out in pain, if we feel soft spots, if we feel bone trying to stick out of the skin or sticking out of the skin, or we hear bone grinding on bone, we want to expose that spot and put eyeballs on it and make a note of it.